I'm Michael Barasch of Barasch McGarry, and I want to welcome you all to our webinar in honor of National First Responders Day. In 2017, Congress designated October 28th as National First Responders Day. This resolution honors the firefighters, police officers, EMTs, and all those who are on the scene in stressful situations. First responders all across the country, as we know, put their lives on the line to keep Americans safe every single day. And on 9/11, over 100,000 first responders from every state in the country and Puerto Rico rushed to the scene at the World Trade Center, the Pentagon, and at Shanksville. The FDNY response actually began within 5 seconds of the crash into the World Trade Center because engines 10 and ladder 10 are literally right across the street from the Trade Center. Today, we honor all first responder heroes and the sacrifices that they make every day, not just on 9/11. We've got a big group of panelists today. So we're going to talk about the programs. We're going to give you some resources that are available to you from both the American Cancer Society and the Firefighter Cancer Support Network. I usually like to start our webinars with a short video that kind of sets the tone for that day.
The first responders who came back to a war-torn neighborhood that was clearly toxic, I'm in awe. It's your courage and your resilience that brought this place back. So please, I urge you, access what you are owed.
Over the last decade, we have all fought very hard so that everyone has access to the health care that they need. It is very important that every community member, anywhere south of Houston, understands that you are covered. You are part of the group of people that have guaranteed health care if you have a 9/11 related disease.
So we have taken on, with all of these advocates here, the task of trying to get everyone to understand that they have rights, and it is imperative that they sign up.
One of the really surprising things about our research is that an event in 2001 can continue to have echoes decades later, such that it is as though never smokers are smoking 2 packs a day.
People don't realize that they are eligible, and for many people, it's not a question of if they're going to get sick, it's a question of when.
How do I prove my illness was caused by the 9/11 toxins? You don't have to prove that, it's presumptive. You only have to prove that you lived or you worked in the downtown area.
Many of us returned before the fires were out, without proper equipment, without proper advice from professionals, and now a slew of health conditions, respiratory issues, and many cancers.
We have about 100,000 responders in the 9/11 community. Basically, to be entitled to compensation, you need to prove that you were below Canal Street or on the Fresh Kills landfill, either caught in the dust cloud on 9/11, or for 24 hours during the month of September 2001, or for 80 hours between 9/11 and May 30th of 2002.
They responded in 5 seconds. They did their jobs. Do yours.
Well, that last clip was from Jon Stewart in front of the Judiciary Committee. And, we always thank Jon Stewart because he shamed Congress into doing the right thing. So many of our politicians loved to wave the flag and wrap it around themselves and tell everybody how much they remember and they'll never forget the responders, those who died on 9/11, but they were forgetting. And then thanks to people like Jon Stewart, John Field, the unions, it took a village, but we got the Zadroga bill passed. You'll hear about that in a second. It created 2 programs, and you're going to hear about that. And I want to start today with Fred Endricott. Fred, thank you so much for joining us today. Fred is the recently retired chief of FEMA's Urban Search and Rescue Branch. He spent 40 days as the FEMA Urban Search and Rescue Operations Chief at the World Trade Center collapse, beginning actually on 9/11. Fred, thank you for joining us today. First of all, tell us a little bit about your experience in New York and what you and the other search and urban rescue people were doing.
Thank you, guys. So there are 28 federal urban search and rescue task forces. The system is comprised of about 6,000 personnel, the majority of which are firefighters. As Mike mentioned, between the Pentagon and the World Trade Center over a period of a couple months, I think all but one of the federal task forces responded. So the potential for a lot of exposure, certainly Michael spoke early on to the one case that really hit home for me. I was an officer in Rescue 1 in Philadelphia, also a member of Pennsylvania Task Force 1, and I also served on the incident support team or the overhead management team for FEMA USAR. That's my role at the Trade Center. But Pennsylvania Task Force 1 responded mostly with firefighters from my company. One of them was one of my senior guys. He came down with pancreatic cancer and passed away. So after Michael, I had met Michael and the team at our meetings where they spoke to the importance of what's available to responders. Talking about the World Trade Center Health Program and then the Victims' Compensation Fund and how that ties together and what's available. But, we were really concerned on the federal level of getting the word out to everybody that responded to those events to let them know how much help there was and how much hard work had been done with the Zadroga Act to just continue it. So the long story is when Richie passed away at Pennsylvania Task Force 1 with the help of the FEMA Headquarters Program Office, we started putting together his case. And when we realized how complicated it was, the Richie's widow, Laura, reached out to Mike, and Mike asked me to testify in front of the special master in Washington, D.C. when Richie's case was being heard. So I just want to let you know how important it was to have professionals that deal with this help dumb firefighters like me and the others from Philadelphia, work through the legal system and getting the benefits that John and Mike spoke about. The bottom line is when Richie passed away, Laura got half of his pension. And so when the case was favorably decided and adjudicated in Laura's favor, it changed her life financially. So I guess my final point is there's a lot out there for us. And certainly people who have paid their dues or responders, not just on the fire side, the police side, what a difference to be able to avail yourself of not only the health program, but in the worst case scenario, when a loved one passes, to have the family have some type of compensation to help them through life without their loved one. So, Mike, I thank you guys so much for all you've done for the federal side of things and all you've been doing for everybody else. Thanks.
And it's really an honor for us to do this for you. Let's go right to Dr. Shastri from Montefiore Einstein Cancer Center. We recorded a short interview with her where she talks about a study she did on behalf of firefighters.
Hi, everybody. I'm very excited to join you on this call and share with you what I know, and hopefully some of this will guide you for your future care and, just inform you of various options that you have. So as a hematologist, we treat patients with blood cancers with chemotherapy, but we also treat them with bone marrow transplants. And some of you might have heard of recent therapeutic options like cellular therapy or CAR T cells. So we employ lots of different ways of treating people with blood cancers. My specific presentation is actually focused on some work that was done at Einstein in collaboration with the Leukemia Lymphoma Society and the FDNY and the Memorial Sloan Kettering Cancer Center, specifically on early detection of precancerous conditions that could be a future risk for blood cancers and first responders after 9/11. We do know that environmental exposures do add on to whatever underlying genetic risk that we have for developing cancer. And then, we have occupational hazards, right? People that have exposure to noxious gases at their work, and these things can increase your risk of developing cancer too. So right after the 9/11 disaster, we actually started this project at Einstein, where in strong collaboration with the FDNY, we started really collecting the history as well as looking at the blood of all the firefighters that were actually exposed to the World Trade Center disaster. And we compared it with controls. So when you say control, it means a group or a population of firefighters that were not exposed to the World Trade Center disaster. And we studied their blood as well. And we wanted to see if there are increased rate of acquisition of mutations. So these bad deleterious mutations that can cause cancer, and whether that increases your risk for causing leukemia. So I just want to show you this, that there was dust that was collected from the site. And as you know, there was a massive cloud dust all over Manhattan and into the other boroughs for several days. That settled into the surrounding area. And then researchers collected samples from 3 different locations to actually study the composition of this dust. And some samples were taken on day 5, and then a few afterwards on day 6. And when we analyzed the composition of this, it seemed like the dust that was collected from the World Trade Center was highly toxic. And if you look on the right side here, the schema shows you that it had so many different chemicals that we consider carcinogenic, pesticides, benzol containing compounds, PCBs, asbestos. So this was actually highly carcinogenic. So I just want to say thank you very much for your attention. And I went over some very basic things. I want to just reiterate that at this point, in terms of blood cancers, we do know that there could be preconditions or pre-disease conditions in the blood for people who were exposed to the 9/11 World Trade Center disaster. And these can be picked up with simple blood tests. And if people do want to check them out, they are easily available. You can talk to your doctor, or I'm more than happy to talk you through your risk or whatever you need to do. Please feel free to get in touch with me via email, or I left my number there to schedule an appointment or to give you a call back. I'm happy to discuss this further with you. So thank you for your attention.
Well, I really appreciate Dr. Shastri agreeing to speak to us ahead of time, not only because she did this study on the FDNY and hematology, but it sets the stage very nicely for what we're going to talk about next, which is the fact that it's not just blood cancers that have been linked by NIOSH to the toxins. So let me just show you a brief outline of the most common cancers linked by NIOSH. And again, it doesn't matter if there's a family history. It doesn't matter if you were a smoker. If you were exposed to the toxins, then skin cancer is the most common because the air was so toxic. Basal cell, squamous cell, melanoma. I can't tell you, I was at a retired firefighter seminar yesterday. So many guys said, oh, thank God I've never had cancer. And I'd say, what about that scar on your face? And they'd say, oh, that's just basal cell. Well, that is skin cancer. So is squamous cell, and of course, so is melanoma. Almost every cancer you can think of is now presumed linked to your exposure at the World Trade Center, at Shanksville, and at the Pentagon because of the toxicities in the jet fuel as well, and the concrete dust. Obviously, many non-cancers are also linked. The most serious being pulmonary fibrosis, which is what killed New York police detective Jimmy Zadroga for whom Congress named the bill. And that's a perfect segue to John Field. John, thank you for joining us today.
Well, thank you for having me, Michael. So back in 2004, we started walking the halls of Congress for the 9/11 health bill. In 2010, we got the bill passed the first time. 5 years later, we got it renewed on the healthcare side till 2090. And then in 2019, we got the compensation part renewed till 2090 to coincide with the healthcare. This bill is available not just to first responders, and volunteers, but those who lived or worked or went to school in Lower Manhattan, plus Shanksville, and plus the Pentagon. We are now working on a bill that's going to be attached to the NDA that's going to allow about 900 Pentagon military people to get into the program because they've been excluded for the last 20 years. Take advantage of these programs and listen to these experts today. We lobbied for 2 decades. Richie Alley's was there, Barasch McGarry was there, and they joined in the fight. And while some people made 5 trips, some people made 10 trips, some people made 15 trips and then died, I've been there over 350 times, and it was painful physically and mentally. But we were there for the tens of thousands of people that could not join us. There's now over 27,000 people with a certified 9/11 related cancer. That's way too many. And I implore everybody, sick or not sick, to get into these programs. If you lived in Lower Manhattan, the map is Houston, south of Houston Street, to the water, to Brooklyn. If you're a first responder, volunteer, south of Canal Street. The Pentagon is the Pentagon and Shanksville is the Shanksville. So if you know somebody who's not on this webinar, let them know. And I hate to be the Debbie Downer in this party, but you're at a 60% chance higher than the general population of getting cancer now. The saving grace to this, it's presumptive. It is presumptive. So if you were there, you have proof that you were there, get into the program. Get your affidavits now, even if you're not sick. Get your friends or your colleagues or your old employee to write an affidavit saying that you were there. We'll shelve them for you, or you can shelve them. And when you're ready to come forward, it's going to help you get into the program, and it's going to be an easier access for you if you do get sick in these the World Trade Center Health Program or the VCF is going to be able to expedite your claims.
Thanks, John. And that's a perfect segue to Richie Alley's and Val Stetz. Richie is a deputy chief with the FDNY. He's retired now. And I'll let you tell, Richie, you tell your story. And then Val is a retired Jersey City police officer who's made it her life mission now to get people in New Jersey to enroll. So Richie and Val, thank you for joining us today. Richie, why don't you lead off? Tell us a little bit about the health program and how passionate you feel about it.
Thank you, Michael. And as Michael said, I'm a retired deputy chief for 38 years in the FDNY. I am now a week away from getting officially diagnosed with prostate cancer. What happened? 6 months ago, I had my World Trade Center medical, PSA, which is part of that test, stable and in the safe zone. 6 months later, I went to see my personal physician who also takes a PSA because he knows of my exposure. And my PSA shot up. Immediately sent me to my urologist. Urologist sent me for an MRI, which is now confirmed 99% chance that I have cancer. So a week from now, I'm going to get the diagnosis that I know. Am I worried? No. And why? Because early detection and early treatment. I'm going to get authorizations from the World Trade Center Health Program. I'm going to be able to go see the top doctors wherever I want to go. So what are the reasons why you need to be in the health program? And this is critically important. That annual medical screening, they focus in on the respiratory ailments that are common, and they do cancer screening, plus evaluate you for PTSD. Prescription coverage. You all on this call, if you're a first responder and in a union, you have a prescription plan. Never, ever use your union prescription plan to fill any 9/11 related illness. Why? Because nobody has a perfect plan. There's co-pays and there's annual caps. If you have a 9/11 related condition, you need to have it certified by the World Trade Center Health Program so that you can get your prescriptions filled by the federal government, completely paid in full. It's a requirement of the law. Oh, really? Yes. Especially, and I'm speaking now to those members on this webinar that are healthy. Good for you. You still need to be enrolled in the health program so that when, and it's not if, because I'm going to tell you all right now, it's not a matter of if, it's when you get diagnosed with a life-threatening respiratory ailment or a cancer. It's happening. Trust me, it's happening to me right now. And I've given this lecture for over 16 years doing this. So please listen to me. And then finally, the fourth reason that it's a national program. It doesn't matter where you are in the country, all 50 states. Why wait for yourself to get sick? Do it now, especially if you're healthy. That's the best advice I can give everyone.
Yeah, thank you. Valerie, thanks for joining us. Tell us a little bit about your experience as a Jersey City cop with the World Trade Center, what you've been doing since you retired.
Yes, thank you, Michael, for having me. I appreciate it. As soon as I retired from Jersey City Police, I went into the medical field and started businesses for doctors as a management corporation. And from there, I met you, which was great. And you asked several times I met you. Probably the third time I said, yeah, I was there. Like, nothing's wrong with me though. So like, leave me alone. So, and then I said, I don't have anything wrong. And you mentioned basal cell. And I was like, oh, I had that. And you were like, oh my God, like that's cancer, you know? And I was like, oh, I didn't think it was a big deal. I had it in 2008. And you were like, oh, well, then you really should sign up. And I was like, but what do I have to do? I just thought it was a long process. But you made it really simple for me. And your employees at the office made it simple for me. And I signed up and I said, well, if I don't know about this, and I'm very involved with police and fire in New Jersey, you know, with medical, in the medical field at that time, I said, if I don't know about it, they definitely don't know about it. I thought really it was for New York firemen and police. I experienced certain things like sinusitis, GERD for years, and bronchitis and asthma. And I never associated any of that with 9/11. You might think it's a little thing, but it's not, because in June I had a sinus surgery and it was horrible. So that was just this past June. I had one years ago. Obviously it didn't work. So I had to have another one, more aggressive. And then right after this surgery, I get a call from my dermatologist stating that I have another basal cell. So I have to have another surgery for this on my leg. And this is from 2008. I haven't had another one. And now I get another one in 2023. So it's really serious and you have to take care of yourself. I tell first responders all the time, they never want to take care of themselves. They take care of everyone else, but they don't want to take care of themselves and go to a doctor. It's so simple. Try to eat well, go to a doctor, go to the health program. Like Richie states, he knows because he's a firefighter. I know because I'm a cop that, you know, we're the worst.
Well, I was not going to share with everybody about your medical condition, but I do appreciate your being so forthright. Richie, the same with you. You haven't even told people in my office yet about your own health, and I appreciate it. This is my partner, Lee London, who runs the Victim Compensation Fund practice here at my firm. Lee, would you tell us about the work you're doing and the Victim Compensation Fund?
Thank you, everybody, for being here today. Let me just talk about the Victim Compensation Fund, because when the Zojoga Act was created, you have the World Trade Center Health Program on one side and the Victim Compensation Fund on the other. Two government programs that work together, but they're completely separate. So if somebody's walking through the door today And let's say they have a non-life-threatening illness, such as, let's say, asthma, GERD, sleep apnea. Those conditions can range between $20,000 and $90,000. These awards will not ever get put into place of the sacrifice that everyone made that day. It will not solve all your problems, but it is something that will help you and help your family out. So when I have to explain to someone why move forward, do it for your family. You're not moving forward for a $20,000 to $90,000 reward. You're moving forward, God forbid you get that serious cancer. God forbid something else happens to you. So not only can I make a non-economic loss for your pain and suffering, but I can make a loss of earnings claim for you.
So Jennifer, would you tell us a little bit about the benefits available under the wrongful death program?
Yes, thank you everyone for being here today. The types of losses that the Victim Compensation Fund will award is compensation for the victim's pain and suffering, compensation for pain and suffering to a surviving spouse and their dependents, reimbursement of the costs associated with the funeral, reimbursement of the costs associated with the loss of services the victim used to provide to their household. There's also a lost earnings component if there was some lost income. In addition, the Victim Compensation Fund will also award a standard earnings award to FDNY and NYPD first responders who had retired before 9/11, but still responded to the World Trade Center site in wake of the attacks. As you can see, some of these awards, when they're added up, they can be substantial. They can range anywhere from hundreds of thousands of dollars to over $1 million, depending on the victim's age at the time of passing, the number of dependents in their household, their income. Another unique thing that we also like to stress to families is to protect your family is get a will. If someone has a will, the surrogate's court process is much easier versus when someone does not have a will. In addition, you also get to pick who you want to be the executor of your will, as well as who you want to benefit from your estate. A lot of you out there may not know, our office actually does free simple wills for people who are residents of New York State. So if you don't have a will, I do encourage you to reach out to our office and we can set you up with an appointment to make sure that you do have a will.
All good advice, Jen. Thank you so much. I want to turn now to Russ. Welcome. Tell us a little bit about what can Firefighter Cancer Support Network do to anyone in the country who gets a diagnosis of cancer, whether or not it's a 9/11 cancer.
Sure. So with the Firefighter Cancer Support Network, since 2005, we have been delivering support to firefighters that are diagnosed with cancer. We also deliver education program, and you've all said it, and I'll say it again, that early detection is critical. It is one of the most important things you can do is advocate for your own health, get checked, get your annual physicals. We know that firefighters have a higher prevalence of cancer across the nation, whether you're at the World Trade Center or you're a part of this program or not, you still have a high level of cancer. So what we offer is a couple things. We offer a badge-to-badge support program where we have firefighters across the nation that are cancer survivors. I think we've all kind of said it tonight, or most people have, we're a little bit different. Whether you're a police officer, a firefighter, EMS worker, we think of things a little bit differently. So a peer support program of somebody that's been through that cancer and survived it, it can help you understand the uniqueness of what's going to come and not fill you full of crap and tell you exactly what it's going to be and not kind of sugarcoat it. I think that's an important thing for firefighters to be able to have. And it's brother and sister to, it's family member to family member is what it is. It's the firefighter to the firefighter or the EMS person or your family, anyone in your family as well. So we have several hundred folks. It's easy to access. All you need to do is call 866-944-FCSN or go to the website, which is firefightercancersupport.org. There's a request link there. You put it in. We have somebody contact you within 24 hours.
Thank you, Russ. Austin, I'd like to welcome you again. Austin's with the American Cancer Society. Austin, tell us a little bit about the support that the 9/11 community and anybody else, by the way, because your organization's amazing, can get from the American Cancer Society.
We appreciate the opportunity to talk more about who we are as the American Cancer Society. As you can see there, I think our mission really sums up who we are as an organization, right? So we are working to improve the lives of people with cancer and their families. And we do that through, and you can see on the screen here, through advocacy, research, and patient support. And we are the only organization that focuses on all three of those things at the same time, right? So, and what we want to make sure, again, right here, you can see, we want to ensure that everyone has the opportunity to prevent, detect, treat, and survive cancer. We define someone as a cancer survivor from the moment you hear the words, "You have cancer," to us, the American Cancer Society, we consider you a survivor. And we want to support you through the entire journey, whether that's prevention, detection, treatment, survivorship, or working with caregivers. We are here to offer so many services. One of those things is our Hope Lodges, which people may not know about, right? There's one right on 32nd Street, which is where I work. It's essentially a hotel for cancer patients and their families to stay for free as long as they need to when they're traveling for treatment. We have over 30 of those across the country, strategically placed where national treatment centers are. We have a program called Road to Recovery, which is where we help get free or greatly reduced rides to treatment for cancer patients. You could get an appointment at the greatest oncologist in the world, but if you can't get there, that appointment doesn't mean anything. So those are some of the patient support services. And then in terms of research, since our inception, we're a 110-year-old organization. No one other than the United States government has given more to cancer research. Currently, over $6.9 billion we have invested in our history into cancer research. It's October, Breast Cancer Awareness Month. We currently have nearly $80 million invested in breast cancer research grants. So if you or your family is going through cancer, if you know someone, we have resources. You can call us for free, 24 hours a day. We speak over 60 different languages, live people on the other end of the phone, 1-800-227-2345, or online at cancer.org. And thank you again for the opportunity to speak about the American Cancer Society and the services and the programs we're providing.
Well, you guys are terrific. And I just want to end now with a repeat of a summary of what I think everybody should be doing to protect themselves. Guys, please get the help that you're entitled to, that you deserve. Take advantage of the American Cancer Society. Take advantage, if you're a firefighter, of the Firefighter Cancer Support Network. Use us as a resource. Feel free to reach out to these organizations yourselves. As I mentioned, you don't need to have an attorney. You can go to cdc.gov/WTC to enroll in the health program, or go to vcf.gov for the Victim Compensation Fund. But most importantly, even if you're healthy, secure your evidence now that you were in the exposure zone, that you were at the Pentagon, that you were at Shanksville, wherever you were. Get that evidence, save it in case, God forbid, you ever get diagnosed. Help us spread the word. And if you have any questions, you're always welcome to call us. Be each other's advocate. It's a pleasure to have been here tonight. Thank all of you, all the panelists, for joining tonight. I really appreciate it. Good night, everybody. Stay safe, stay well.